Hi, everybody. I was about to say hi, Casey. Say hi to myself. Anyway, hi, my name is Keisha Williams, and I will be doing the video on Trach Care. So, the supply kit did not really come with what I was expecting to be able to do this video. So, I guess a lot of it is just kind of working with my imagination. I did go ahead and open this so I could see what all was in there. I was hoping that when this came, it would have had like a one of the tricks in place so that we could use it as practice to clean, because I did ask for extra supplies for that so I could practice, just practice so that I don't forget how to do stuff, and I just kind of want to keep up to date with these kind of things. But it didn't come with it, so I guess we're just gonna have to go off of just imagination and tell you guys what we're doing with this. I did cut up a straw. I cut it up to the length of a trick, I believe. It's not bendy as a tray, but it's the best that I could do, and I'm gonna use it to wash because I really wanted to use something to show you guys actually how to do it. So with this scenario, I'm assuming that we're using one that goes back in and not a disposable ones. And from watching videos, I saw some that had a quite different types, but there was disposable ones where you could just dispose of and replace, and then the ones that you put back in. So I'm gonna pretend that this is the one that I put back in, and I'm just gonna put it in that trick hole right here and pretend that we have a trick in here. Oh, I can't get it to stand straight now. I did so well. We're just gonna visualize. This is gonna be my patient Jane Smith, and it didn't come with the kit, didn't come with peroxide or the saline. I was kind of hoping that it did, but it didn't. So I'm just gonna pretend that this is my alcohol. My saline. And then this is gonna be my peroxide. And then I'm gonna use this bowl, some clean gloves. The kit also didn't come with any tape, but I did have some tape from my other stuff in case I needed it. But this doesn't have an expiration date, but pretty much if everything that you use, you want to make sure that it has an expiration date. Your alcohol, the saline. I keep saying alcohol because whenever I use peroxide, there's always alcohol, rubbing alcohol. So I keep wanting to say alcohol, but I mean saline. So you want to check your saline. It should have an expiration date on it if the bottle is brand new and you're the first to use it. Once you open it up, just you want to initial the bottle and date and time it so that they know who opened it, the date and the time it was opened, because I believe after 24 hours most hospitals consider it not sterile anymore. But yeah, after 24 hours, I believe the saline is not sterile anymore. So you always want to initial date and time when you open the bottle. Um, so in the kit has the sterile gloves. I keep losing my words. In the kit has the sterile gloves, and these are my non-sterile gloves. And I will start with the non-sterile gloves and then move into the sterile gloves. And as I go along the way, I'll just explain what I'm doing. So before we go ahead and start, before I introduce myself to the patient and we go ahead and start, I believe this video is more focused on the cleaning aspect and not the suctioning aspect, but you always want to, when somebody has a trach, suction is one of the things that you pay attention to. You look for the signs that there might be extra secretions, like if a person is coughing a lot, that might mean that there is, a little bit more secretions going on there, so they might need some suctioning. So there are just things that you need to look out for to determine if the person needs some secretions removed or if they need some suctioning done. And then you also want to always check all your equipment, make sure that all of the equipment is functioning as well. So for like when you're doing your assessment, like you're observing for, like I say, the extra secretions, you're observing the skin around the stomach, you're observing the stomach, you're looking at the patient's hydration status, you're looking at the date and time of when any suctioning was done. So you're gonna do like a normal assessment and just kind of making sure that everything's okay with it. Now if I was to suction the patient, you always want to make sure the pulse oximeter is on. You just want to always make sure that the pulse oximeter is on, that you're listening to the breath sounds. It's part of an assessment. When you're doing an assessment before you care for the patient, you you listen to their breath sounds. So you listen to those breath sounds. And then one of the things too is that you always do hyperoxygenation before you suction. So it's important to remember to do hyperoxygenation. And from what I understand, it's pretty much when you just kind of have them breathe in, and you use the bag and you squeeze it while they breathe in. And you might want to have them do that a couple of times, 3 times, before you go ahead and do the suctioning. So you'll just have them, breathe in and squeeze the bag. And then the suctioning part is also done with a sterile as well, because there's a kit that comes with the suctioning tube. This one doesn't have it, but there was a kit that comes with the suctioning so that you could perform suctioning if the patient needs suctioning. And then when you're doing this, not just the suctioning part but the cleaning, always elevate the bed to a height that is comfortable for you so that you're not straining your back. Could you imagine having to bend over the whole time trying to clean, especially if the procedure is sterile? So you just kind of want to raise the bed to a level that is comfortable for you so that you're not overstraining yourself. And then you want to raise the head of the bed to a Fowler's or semi-Fowler's or a 40-degree angle. So you'll just raise the head of the bed to like a 40-degree angle. And then you just want to check for any signs of the extra secretion. You want to inspect the inner cannula. And pretty much, yeah, that's just when you're suctioning. So these are just some of the things that you're doing while you're suctioning. And once you're done suctioning, you go ahead and you just put everything back together that you removed or anything whatsoever. Now we're going to go ahead and do the cleaning portion, and that's what I will demonstrate for you. Just cleaning out the trachea. So what I will do is I will come into the room and introduce myself. Hi, my name is Nurse Casey. I'll be your nurse today, and today we're going to be doing your trach care or tracheostomy care. So I'm just going to go ahead and clean your tracheostomy for you, and then I'll have introduce herself. She says, my name is Jane Smith. My birthday is March 30th, 1980. And then I'm going to go ahead and check her wristband, make sure that her full name and birthday is according to her wristband. If it wasn't the same, then that's a problem. You need to ensure that it is the same before you provide care. So what she's saying need to match what is on her bracelet. Then I'm going to go ahead and perform my hand hygiene. I'll just do that real quick. I'm going to use my sink as my trash can, by the way. So like I said, I don't know if I mentioned earlier, this is going to be I'm going to take off my wedding rings. It's kind of hard to put gloves on with them. But this is going to be a sterile video. So we always want to remember that our sterile film needs to be kept clean. We want to be 1 inch, keep that 1 inch margin for a sterile fill. If your sterile fill gets contaminated, you do need to start the process all over again. So sterile, I have a small area to work with, so very patient with me. I'm gonna move him a little bit closer here. So what I'm gonna do first is after I've already done my identifiers and stuff, I'm just gonna go ahead and make sure that I have all my supplies ready. I'm gonna check if I was performing the suctioning as well. I would make sure that the suction machine is working, that the patient has an extra kit from what I saw in the videos. And I don't know if that's how it really works, because I honestly don't know. But they were saying that in the room by the suction machine or something of that sort, you want to make sure you have a kit, one of these kits, like right on top of the machine, just in case of an emergency. But that may not necessarily be true, but I'm just kind of learning as I go, so I don't really know. And I don't want this video to be more than 15 minutes long, so kind of trying to speed it up. But anyway, I'm just going to make sure that I have all the supplies that I need ready. I'm going to make sure that I have an extra set of sterile gloves, because the kit comes with one, but I'm pretty sure there might be others in the hospital where you could go get some. I don't know. But I think it's important to have 2 sets of sterile gloves, just in case, something happens. And these too. So if you break that sterile fill, then you have that backup supply, so you're not scrambling around. So you kind of just make sure you have everything that you need. You explain what you're doing to the patient so that they know what's going on. You explain what you're doing during the process. And you always use your Even if you're not giving medication, but just make sure you're doing those right identifiers so that you know that you're treating the right person, etc., etc. So I've washed my hands. I'm gonna put my gloves on. I've made sure that all my equipment is there. In the real world, you would have that side table that you could use, or maybe a mayo tray that you could use. I don't have either one of these, so I'm gonna work off of my counter. So I'm just gonna use these, and then you just kind of tell the patient what you're doing. So this is my, I'm gonna bring it back right here. So in this video, I might be breaking my sterile fill just because I have to get you guys to see what I'm doing. And okay, that might work. So the patient has the tire around their neck with the trach tube in. They have that gauze under it, you know, just everything usual that you would have in a trach tube. So what I'm going to do is I've already performed my hand hygiene and then everything. I put clean gloves on. I'm going to take this out. Well, actually, I'm not going to take this out. I'm going to set up my workstation first completely. Oh, go. Sorry. So I'm going to set up my workstation, but let's see. Yeah, I'm gonna set up my workstation. See, this kit has some of what I need, and I gotta put my trick tube in that sterile solution. So I'm kind of trying to figure out how to do it as I go. But according to the video, and I'm just going off of the video that the school had, not the video that I found on YouTube and stuff like that. So what she did was she said that you put this and this together, same amount in one bowl. And I'm going to also use this, but I'm going to use it for a different thing. So you mix it together. So I have saline, peroxide, full equals amount, she said. I'm going to put it down. Now, in this kit, and you're supposed to have a sterile fill for it, which I don't really have a sterile fill for it. We're just going to pretend that this is my sterile fill. And this is also supposed to be a sterile procedure. But let's just remember, when you're pouring the saline, you want to keep that label covered too. I don't think I mentioned that. Keep the label covered when you're pouring it so that it doesn't get wet, because you want people to see the date it was open and the time it was open. And if the bottle is wet, it's all smudged, they can't see. So when you're pouring the saline solution, this portion needs to be covered up. So you're pouring it like this with the label covered. It's like, yeah, so they don't see. And then if you wet any of your sterile fill, you're going to have to start over because you've already break that contamination. So we're keeping these together. And then what I'm going to do is, and it's different, like I say, for every video, because in the normal videos that I've watched, and probably how I would do it too, and based on the criteria for this video and the video, you would open up this kit. So you open up this kit. I'm gonna push this head back. I'll just take this whole thing off. I'll save it in case I need to glue it to use it again. See, so it comes with the sterile gloves in it. Now you would be careful. Sorry, my eyes are on fire. Touch it, any of this. But this portion right here, you can see this empty cup. You could pour the saline in here with the peroxide together to clean it. Now, I've also seen videos where some of the kits came with like free cups. So it came in the package, had one, then there was another one sitting in the package, and then you had this side in there. So they would put peroxide in one, saline in one, and then saline in another one. So, oh, I'm so sorry, you guys. I would not do that in the real world, but I don't, my eyes is on fire. But this one, we only have this and this, so I'm gonna do it to her according to how she did it on the video. So she makes the peroxide and saline in one, and then she put alcohol in one. It's kind of hard to do. It's really hard to do not having a set space to work with. I'm just gonna grab a napkin real quick. I'm so sorry. But I would change my glove if I did that in the real world. And I hope in the real world that my eyes not bothering. But I've been having some eye problems lately. So I don't know what it is, but anyway. So this part, like I say, when you pour covering the label, and you don't wet around anything or anything. And also in some of them, it comes with tweezers, so that when you're pushing the gauze up, you could use the tweezers to pull the sides so that it could go under there without you trying to reach your finger under there. But this one doesn't have it. But this one does come with the sterile gauze. It does come with the drip. The drip, you put it over the patient. Over the patient, it comes with a tie. Some of them, they do have it. Well, it depends. Some of them have a tie. Some of them has like a tack. I can't think of the name. So, but this one has a tie, so where you have to replace it. And then it comes with the, it doesn't even, okay, it does. It have the Q-tips. It has the thing that you scrub the thingy with. I'll just show you guys how to do. But anyway, I have the peroxide and the alcohol saline in here. I have the saline in here as well. And I don't have another one. This one doesn't, okay, I don't think so. But you want to, this fill will definitely be a sterile fill. You're keeping in mind that 1 inch margin. You're never turning your back on your sterile fill. So if you're going this way, you're still looking this way, you're still looking that way. You never turn your back on your sterile fill. I will use just my clean gloves. We're gonna put this here like this so that one space could be the sterile fill. And that's just me reaching over my 1 inch fill. But I'm just trying to make sure that you guys could see everything. But anyway, I'm gonna take this out from the patient with my clean gloves. I'm gonna take this out. Just pretend this is my trick thing. Then I'm gonna put it in my saline and peroxide water. And then what I'm gonna do is I'm gonna take the gauze pads, the gauze thing out. You wanna have somebody to assist you if you're like pretty much brand new at this. I feel like you should have somebody to assist you. If you're like know what you're doing, then that's fine. You could do it on your own. But if you're new like myself, I would have somebody assist me just so that I have that help until I'm comfortable doing it on my own. So I'll put the trick in here. Then what I'm gonna do is I'm gonna take out that soiled gauze that they have there under the neck. So I'll take out the gauze bars under the neck, just wrap it up in my gloves. The soil dressing, sorry, and then put it in there. I'm gonna save my gloves, so I'm not gonna trash my gloves. I need them for other video purposes. So we're just gonna pretend that I put the soil dressing in here and that I trashed it in my trash can. Still not contaminating my sterile fill. Then I'm gonna wash my hand again, or I'm gonna sanitize my hand. I probably will sanitize my hand because it's easier to sanitize my hand. Then I'm gonna put my sterile gloves on, and then I'm gonna wash the trick. I'm gonna wash this, and I'm gonna clean this. I'll just do it. So I'm gonna get my sterile gloves. Again, we're gonna pretend that this is my sterile fill. So what you wanna do is that, I don't know if you guys could see, but this one is not wrapped up like the other ones. So I'll show you guys. It comes like this. So I'm gonna place it down. It tells you to cuff end. So you know that's the cuff end. So you're gonna open it, and you want to open it to where when I open it, I always bend the outside like this so that it doesn't like reflect on me. So I try to keep it as sterile as possible. So I just fold it and then I unfold it. Then it gives you those two edges where you can push your fingers under it like this. So you could just open it. And when I do, I make sure that the edges are folded inwards too. So now I'm going to put my sterile gloves on my dominant hand. So I'm going to grab the outside like this. And then I'm going, oh man, these ones are super small. I don't know if it's gonna fit me, you guys. Oh my, these ones are really small. I honestly don't know if my fingers are gonna reach in there. Whoa, we're gonna try. But I'm not touching the inside of the gloves. I'm just touching right here on the outside. But these ones are a little bit tiny. Oh, I don't know if they will be able to. I'm gonna really try to get them in, sorry. But they're really tiny. Oh, and you make sure that your gloves don't touch anywhere and you're still not breaking that sterile feel. Oh, okay. I think I got it in there. And I'm still not touching the outside, like I'm not touching anywhere of my glove. And then I'm going to take, with my sterile gloves, my drape. If there's a real patient, I would open this drape up. I don't have a real patient, so I'm not going to open the drape up. And you just put that drape on top of the patient's chest. I'm just going to set it to the side. But you would put that drape on the patient's chest. Now, what I also saw from the video is that you would take 3 of the cotton swabs. So we want 3 of these, and you just place them in the saline water. And I could see why some people have 3 set on a side. So I'm going to pretend I have a 3rd one. But this one actually comes with 5. So that's awesome. So I will use 5 since it comes with 5. Yay. But anyway, I'm just using my sterile gloves to put the cotton, oh gosh, I can't remember the name now, cotton tips in some saline water. Then I'm going to get my other sterile gloves on. I'm just not yet putting it on my other hand because I'm making sure that I don't need to touch anything else with my other hand, just so that I'm not contaminating anything. So since I don't, and since this is sterile, I could use this one to go underneath, like this right here. Hope you guys, so I could go underneath, and then I could put this hand. This one's a little bit smaller than my hands. Ugh. Okay. Now, both of these gloves are sterile. I just don't touch the outside. So now I'm sterile, so I'm not touching anything. I don't want to break that sterile feel either. So now that I got my sterile gloves on, I'm going to clean my trach. So this is what you want to use to clean it. It's kind of like washing a bottle. So now if you had the tip right here of the trach, you know, scrub around the trach. I don't know if this will fit in this straw. It fits. So we just take this. It's a little bit tighter. Ugh, okay, so this is how you clean it, like you'd wash up. Oh man, it probably is stuck in there. Like you're washing a baby bottle. Oh. Okay, we're good. So yep, you'll just kind of wash it out in the water, the saline and the peroxide. Just wash all around it. If there was the head, you'd wash around the head. You go in there, you look for the secretions, and then when you're done, cut into the video. When you're done with it, now I don't know if this is several videos I've done differently, so I hope I'm doing it right. But I'm just gonna pretend that I have another bucket here, not breaking my sterile fill, with saline. And I saw some people just use an extra bucket, and you do want to clean it out because it has peroxide on it, and I washed it in saline and peroxide. So they had a food bucket with just the saline. So once they were done scrubbing it, they used that bucket to rinse out the tube with just the normal saline. Now in this one, I don't really have much gauze. But once you've rinsed that out, you want to take your gauze and you just want to wipe it really, really clean. And then they do provide you with these. These are so you could dry inside the tube like this. Oh, maybe I could do it one at a time so it doesn't get stuck in there. And anything I put away from my sterile fill is considered no longer sterile. And I'm not tossing any of these. I do want to save them for practice, so I'm just going to set it on the side and not put it in my wet sink. And then you could use that other one too, just to go through. You know, make sure it's dry on the inside. And put it on the side, and then my gauze, and I clean the inside of it. So you're going to put this back in. Lock it in place. Locked. Oh, it's not going to stay. Okay, so now that we put it back in place, I'm going to save this too. set it on the side. You're gonna want to clean around the stoma. You want to clean the stoma. You're also gonna watch for any extra, just anything extra on the trach. You want to make sure that around the stoma is pink, especially when you're done cleaning it, that it is still pink. So you're cleaning around the stoma and the trach. Then you want to put that V. Once you put that V gauze back on, you will most likely break that sterile fill because you're going to touch the skin with your hand, with the gloves. So it's kind of no longer going to be sterile. Then you want to change the color as well. And if the patient has the oxygen on, which most likely they do, you want to put the oxygen back on. And I don't think I mentioned that in the beginning, but once you get ready to take out that trach with your clean gloves, you're going to just unbuckle it. And it depends on which one they have too, because on the videos I watched, there was different ones hooked up to the patient. So you're just going to want to unbuckle it. That's why you also have them do clean too. So you also want to clean 2 to 4 inches around the stomach, and you want to move in circles. So you kind of just inward, outward kind of motion. So I've already cleaned this with this vacuum paste. Now the gauze that you do have in your not the gauze, the cotton tips that you do have in your saline water, well, saline and peroxide too. So in the saline and peroxide water, you're just, I'm not gonna really do it because I don't want to wet the box, but you'll clean, like I said, 2 to 4 inches around the stoma. So you just kind of clean it, make sure that it's clean. You trash, then you get another one. I would say do 2 for each, like another clean inward, outward, and then clean on the trach itself, you know, inward, outward. Get another one, just do it again, you know. Then I'll get a dry gauze, and then I'll just pat it dry, pat the stoma and around it dry. I won't like, whoosh, you know, just pat it dry. Once it's pat dry, then you're gonna grab your V1s. These are the V1s right here. They're open. So what you're gonna do is, when you have the stoma in there, the trach in there, you're gonna have to go under it to push this back under it. So what you're gonna do is, at that point, you're breaking your sterile fill. So make sure that everything that you needed to do sterilely has been done, because when you're going under it, see this, you're in contact with that patient's skin. So therefore, you're breaking your sterile fill when you're in contact with that skin. And I guess that's why some of the videos, they were using the tweezers, the kid skin with tweezers, because when you're going under there, they have that collar in there as well. You're kind of wanting to have to push it up there in there. So you're pushing that, stop the gauze, that V gauze under the stomach. You're going to have to pull it up. And then when you're changing that tie, which is right here, for demonstration purposes, I'll just put it on here so you guys could see. And we're no longer in that sterile fill. So, but anyway, when you have that tie, always want to make sure that 2 fingers could fit under there comfortably, so that you know that the patient has enough breathing room and it's not like choking them, because you don't want to put it like super tight like this. So you want to make sure you have your fingers under there. So you just imagine that you have this rope under here and you have the trach. So you're trying to get this up underneath there. So you are breaking that sterile fill. And hence why the tweezers come into play, because then you could use it to pull that side and pull that side and get it under there. So you're putting a clean dressing under there and not a soiled dressing. So this you would tie there, make sure that it is secure. 2 fingers could fit there comfortably. You don't want to do more than 2 fingers, just want 2 fingers, and the 2 fingers could fit comfortably under there. And you're putting that oxygen back on there as well. So once everything is done, just make sure that you get that oxygen back on there. I'm trying to make it stick, it's not sticking. Anyway, but once you're done putting that dressing back on there, you just kind of want to make sure that you put the patient's oxygen back on there. Once you change this, all of this is done, you've changed this, you're getting that oxygen clip back under there. And before you put, you kind of just always, like I said, you want to assess the skin around that stomach. You want to assess your, let's take this out real quick. You want to assess your trach. You want to make sure that it looks fine on the inside and on the outside it looks fine. You're assessing that skin around the stomach. You're assessing the stomach itself. You're looking for any extra secretions or just anything that may require some more attention. Um, the color, you're changing the color once you're doing that clean, because if you're cleaning and you're leaving a dirty color, that kind of makes no sense. So you're also changing the color as well. And what I would recommend is that you never just let the trick hang when you're changing the color. Just kind of make sure you secure the color. So you're securing the trick with one hand. When you're pulling this out, secure the trick like this. With one hand, pull out. So it's always secured and you're not just like, you secure it and then you pull it out. Same thing for when you're putting the changing the color. You never just stick one color out and then just leave that trick by itself there. So what I would do is that I would make sure that I would leave the previous color on, get this one attached, flip it around, go around, get it attached, make sure that it's 2 fingers breathable, and then once I know we're okay, I'll just go ahead and remove that old one and just label, just put the initial date and time so people know that I got it changed, the date, the time, and I did it. So like I said, this at this point it's not even sterile anymore, but then you do you do want to put the oxygen back on when all is said and done, and just assess everything, make sure that it's done, and then you're going to take this all and toss it away. And I hope you guys enjoy, and I hope this is what the video was supposed to be. Thank you for watching, and I'm so sorry that it's super long. Thanks.